Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable, presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice, and if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Speaking of reviews, we now have a whopping 42 reviews on Spotify.
What?
Keep those reviews coming, baby!
46 now.
Mm-hmm. Now,
coming in.
Before we move on to introductions, I'm sorry, I have my glasses on. I'm not really sure. I could read that without my glasses. We do need to let everyone know about a new book that we have made here at All-Star. Not we, actually. There are 3 employees here at All-Star who have used their talents to put together a book called Chowder Caught a Cold.
Wow. It's so cute.
It's super cute. It's
so
about
talented.
a dog who visits the veterinarian and what happens to him when he goes.
You'll have to find out.
It's the best veterinary children's book.
That's what I've heard.
Yeah.
You can buy it on Amazon. It's paperback. And it's
Kindle.
Kindle.
You
Thanks,
can get it
Courtney.
on the Kindle.
You can get it on the Kindle.
Yeah. Mm-hmm. So
Look,
digital.
but I just have to
Great
show some of these
graphics.
pages because
It's so
It is
cute.
mind-blowing.
look at this coloring. So what's the matter? Well, it doesn't matter,
It's
but
still
look at the
beautiful.
pictures. You can still see
Yeah.
the pictures. Look at these colors.
Josie did fantastic.
So one
drawing
of our
all that.
registered veterinary
That blows my
technicians
mind
did
that she drew that.
the illustrations, which
Yeah.
I am just like floored with. And our awesome Dr. Kristen Pulse wrote the story.
Yeah.
It's so cute.
And the
Wow, we
amazing
have a
Harrison did the
Wow.
putting
Yeah.
it together.
Wow.
Techno stuff.
I just feel like
Pretty
you're
cool.
gonna read the
I just
book
love the
to us
colors.
now. I'm
Yeah.
like, read it now.
Do you want me to read to you?
Yes,
Okay.
please.
On today's
Anyway.
podcast.
Can we have reading time
On the podcast. I love it.
or every day?
Or every day. It's right.
We should
Okay.
have a day off for promoting the book.
And let's all have a reading circle and then
reading
take a nap
circle.
and have
Let's do it.
snacks.
Oh, we can have mats so that we take naps
Yes.
on.
Oh, yeah. Like Terry does yoga sometimes still.
Yep.
Yeah, that's nice.
Exactly.
Yeah.
So yeah, check it out.
That's
Yeah,
so cool.
it's awesome. Okay, on today's episode, we have myself, the pregnant one, if you didn't know.
Didn't know.
Dr. Ashlyn Duckwall, room assistant and comedic genius.
I know.
Oh,
I
Abby
didn't type it
Depew.
before.
My veterinary technician and how-to specialist, Courtney Vaughn, and the head honcho, Dr. Emily King.
Welcome everybody.
Welcome.
Thank you.
The how-to of the how-tos is here.
It's all everyone's celebrities in their own way.
I know.
I
It's
love
so
it.
amazing.
Have our own little niches.
Exactly.
Niches.
I love that we have created these celebrities.
Yeah.
I mean, they create them themselves, but I mean, like,
Yeah.
we're promoting their celebrity. I think it's awesome because everyone's so unique.
I know.
And I'm into this word authentic right now.
Authentic
Ooh.
self.
Yeah.
Mm.
So
That's a
nobody
good
can
word.
duplicate you, Courtney, on your how-tos because
right.
it's you.
Yeah.
You are your authentic self.
Mhm.
Yep.
I'm pretty cool.
Yeah.
That's
So pretty
Did
awesome.
you guys get some food in before this session?
Yes, I was
I drank a whole coffee.
You drank that whole
like
thing?
I chugged
literally
it.
less than an hour.
Oh
like,
my gosh.
A venti coffee from Starbucks is downed.
Okay, well, we need a seatbelt to hold you in
I'm
that
not
chair.
Oh
feeling
my
Yeah.
god.
Before I walked in here, she's like, I'm gonna throw up.
She's like, I can't get up.
Oh shoot.
Okay.
All right, well,
Well, we
let's
better
get
move
going.
on. Okay. Is a hot dog technically a sandwich?
Absolutely not.
Hell yeah.
Hell yeah.
What? Okay, now what's your reasoning?
You got to have the gas station dog, which has, it's a hot
You gotta have
dog,
the gas.
which is like, if you say hot dog, you automatically think bun and hot dog. It's sandwich.
What makes something a sandwich?
Yeah.
What's your criteria?
You're not
going
going to go in there to make
if
a
you just say,
sandwich.
if you say the thing and it's a sandwich.
But I think hot dog is its own thing.
Yes.
It's its own category. Sandwich is another category.
Oh.
We're not even sure if hot dogs are real food still. You know,
It's not,
made
it's a
of-
lot of
Spoiler alert, it's not.
Filler alert. Yes, I think it is definitely a sandwich.
Wow.
I'm going with
I
sandwich.
don't.
You're
I don't
clearly
think
no.
it like in my brain. I don't think of it as a sandwich. I mean, it's bread, so anything with bread is a sandwich.
Yes.
Well, it's 2 pieces
So
of
a
bread with
corn
stuff in
dog
the
is a
middle.
sandwich because it has breading as well.
Those are fighting words.
I love.
I'm going to say
hot dogs and I
no
love corn dogs.
because
Because it's not
It's
between
batter.
two.
it's still breading, right?
okay. I guess.
Wow. I
So
thought
if
it
you
was
roll a
sandwich.
pizza up,
It's
is that a sandwich now?
Yes.
It's a burrito.
It's called a calzone, which is a sandwich.
What? No.
Wait, a calzone's a sandwich?
Yeah.
Oh my
Yes.
Hold up pizza.
This
He's
is
questioning
escalating.
everything
It's an
I know
Italian
about
sandwich.
life.
Oh my gosh. I
I-
want a calzone
I
right
think,
now. Okay.
but I think a sandwich is like 2 pieces of bread put together, but like
Yeah.
a hot dog is 1 piece of bread.
So if I say I want a sandwich, people are going to think and know I want a pizza
I'm bringing you a
instead.
hot dog.
Yeah, if you want a sandwich.
I just think
Don't
hot
give me
dog
the
is
poops.
its own.
I need some metronidazole.
Hot dog is its own category of food.
Okay, it's its
Abby,
own.
what's your...
Oh, give me the poops.
Oh God. Okay.
She's crying.
It's a hot dog because you don't go into the gas station to make a sandwich.
Okay, fair
That's
enough.
what I was. You're crying.
I know it. Oh, jeez. Okay,
Wow.
would you rather? Go ahead. You ask the next one.
Okay. Would you rather have a pet sloth or a pet parrot?
Parrot.
Sloth.
I
Sloth.
actually asked Jacob the other day if we could get a bird.
Oh, those they live forever.
I know.
And
I'm young.
That's true.
Well, how long does the sloth live?
Long.
I don't know.
Aren't they? Don't they live?
But they don't do much.
Yeah.
They don't talk
I just-
back.
birds are
Like you
small. I
could
just
go
think-
to the store and come back, and it would only be right there.
You can go to the gas station and get a hot
Get
dog.
your hot dog, come back, and he's still right there. You don't have to worry.
You don't have to.
You can be like,
cringe
stay
in a-
right there, and then you run.
You don't have to cringe in a sloth because it can't do it.
All right,
Exactly.
stay right there. I'll be
I'll be
back.
back. See, totally sloth.
Yeah.
Did you get a pet sitter for your sloth on 2-day vacation? No.
No, we only went from.
You can
I
roast
left a crumb along the way.
you can roast the hot dogs on its long talons.
Ew, that opened up something weird, like
Oh
a Wolverine.
gosh.
Yeah.
She's crying again.
But
So
yeah,
everybody would rather have a
So-
sloth and I want a parrot.
I want somebody to talk to. I'll talk to it. Do parrots talk? Oh, okay, I'll talk to a parrot.
But I want an African gray. I think that's a breed of bird.
It
Yeah.
is, yes.
I, yeah. I want one of
They're
those.
meaner though. They're
Yeah,
supposed to be
that's
meaner.
okay.
They're really smart though. They're supposed to be the smarter
Yeah,
of them.
they're just so pretty.
Mm.
I don't know. I
Yeah.
would want a bird.
They are
I'm not
pretty.
gonna get a bird, but I want a bird.
Well, don't bring it here. We ain't treating it.
The bird's dying. Sorry. We're so
Again,
lonely.
the sloth.
yeah.
So if I get a sloth here,
Sure.
Yes. Oh
At least
gosh.
All right.
happy.
What?
Elise
would be
loves
happy.
sloths.
Yes.
They're so cute. They're very cute.
Oh, that was a good.
All
one.
right.
Case collections.
Case collections.
Let's do it. Okay, I'll go first. It was a couple weeks ago. We saw an elderly boxer named Jag for an emergency. And the concern was he was ADR, lost control of the back legs, but in his history, he has really, really bad arthritis, like really weak, walking stiff and all that. So thankfully, he was stable on exam. And a lot of that, what I think happened in the back end was a lot of what we already knew about him. However, what was interesting is we did blood work just to be safe, and his glucose was low. I was like, oh, that's weird. It could be artifacts, so let's recheck it. And the way we recheck it is we only look at a glucose level on a spot glucometer. So take it straight from the vein to the machine, and it was low. I'm like, he's been sitting here eating treats. Like we were giving him a lot of lean treats.
Mhm.
So when you have that consistency, you have concerns about what's causing low sugar. And a couple of different things that could happen is one is his liver failing. But on blood work, the rest of the liver values and production of things were normal. So I'm like, oh, probably not. The other thing you worry about is Addison's disease, so low cortisol. And that was on our radar to test for it. But he was very stable and hadn't had a weird history in the past. So the other one that I was wanting to make sure, because he's an older boxer and they unfortunately tend to get cancer of different things, is something called an insulinoma. So an insulinoma is a growth on the pancreas, and it actually just continuously produces insulin. Well, in the body, insulin is used to take in glucose, and so you have nutrients. So then it kind of regulates itself back and forth. Well, if you have not as much glucose, but the insulin's still pumping, you can get really, really low glucose or hypoglycemia. And then that is where you can see different manifestations. So for him, he'd been actually having tremors that didn't really make sense. And so anyway, what we did is we sent out a panel to confirm. And what they did is basically looked at the glucose level in light of insulin together. And like slam dunk diagnosis is low glucose at a normal range with really high insulin. Well, his was low normal at 64, and usually like less than 39, you're 100% in. And then less than 60, it's still abnormal. And his insulin was really high. So I talked to an internist just to confirm. And unfortunately, our highest suspicion is insulinoma in him. Diagnosis definitive would require advanced imaging and everything. But at this time, owners didn't want to pursue that, which I understood. So management, we discussed, you want them to eat more often, little snacks and everything, because your sugar level's down here. So you need to boost it constantly. So that's what we talked about doing. Sometimes you can add in a steroid for various reasons of the disease process. And we don't need to do that quite yet. So that's good. But we talked about quality of life because his arthritis is so bad. So we decided to still prioritize that comfort and feed him more. And it's been a month. He's been doing okay. So we'll just see. Unfortunately, it's not a good type of cancer. It's usually when they're diagnosed, there's 50% metastasis somewhere already. So
bummer. Very interesting cases, though.
They're rare.
So
it's
interesting.
It's very rare.
He's really old. I mean, he's lived a good life, though.
Yeah, for a boxer,
very
he's
old.
he's like
old for
14,
a
15.
Yeah,
How
that's a
rare
great
is that?
age.
Yeah.
It's very uncommon cancer.
Yeah.
So I mean, I think Dr. Pohl's had one,
Yeah, we've
but
seen it
other
a couple
than
of
that,
times.
I don't know how many you would say you've seen in your career.
Probably
But
2.
yeah,
Wow.
Yeah.
Yeah.
I know for a boxer, he looks great.
Yeah.
Like, in
Still
retrospect,
happy,
he
still
looks-
eating.
Yeah. He's a happy
Good.
guy.
okay,
Cool case. Excellent.
I guess I'll go next.
You go next.
So we had like a husky shepherd mix, maybe something like along those lines, presented for a laceration on her leg. So the owner took her to the park. She was running, cut right the back of one of her rear limbs. So they brought her in. We did sedate her just so we could get a better look at the wound. And it was just like, it's graphic, but there was a flap of skin hanging off. So like I said, we sedated her, cleaned the area, clipped the hair, and then we sutured it all back together. So we were able to save the piece of skin that was there. So we sewed that back down. And then sent her home on some antibiotics, anti-inflammatories, and then a cone, so an e-collar. And they're supposed to wear that for about 10 to 14 days is usually how long we leave the sutures in. So they're supposed to keep that e-collar on to prevent the dog from licking the incision, so they don't create an infection, tear open the suture, stuff like that. So she was doing well. And then it was exactly a week, I think. This past Wednesday, the owner had texted and said that she had gotten a suture out and that there was a lot of blood. So we had her come back in and she had opened up the incision again. So it hadn't been that full 2 weeks of healing. So it was still in the healing process. So we actually had to resedate her, debride the wound because it got infected and was all gross. So it wouldn't heal properly if we didn't do that. So we cleaned it up. And now the owner has to do hydrotherapy, which is you have to apply water, a decent amount of water pressure to that wound 2 to 3 times a day, I think is what they told her to do, or maybe twice a day for 10 minutes. She has to do that because it promotes healing. But the reason that she came back for that is because the owner didn't keep the e-collar on. So even if the dog doesn't seem bothered by the incision, we always recommend keeping it on regardless, unless you can have like full supervision, like you have eyes on the dog all the time, but still the dog, I mean, it takes 2 seconds to lick out a suture. Like it's not hard.
Fast.
Yeah. And they can get it out with like literally if you look away, they can get it out. So that's why we recommend keeping an e-collar on at all times. Like I said, even if they're doing great, keep it on for the full 2 weeks because she had a second surgery that could have been avoided. And now the owner, not that the owner's willing to do it, it's just hydrotherapy is a lot of work. Nobody really wants to do that. So she could have avoided it by keeping the e-collar on. So always listen to your vet.
Listen to your vet.
it's
Yeah,
temporary.
or keep it covered, one of the two. I mean,
money too, so you're not paying for that second procedure and further treatments to help something that could have been easily prevented.
Sure.
Yep.
So, but she's doing fine now. So
Good.
It'll heal.
just
It'll
more
heal.
time healing too.
Yeah,
More
right.
restriction for the dog, and yeah.
Yeah.
Mm-hmm.
E-collars for life.
They look
just
sad
posted
in
a
them.
TikTok about it, about how to
how
align
to
a collar.
yeah, that's right.
Oh.
I watched
Yeah.
that bad boy.
There's multiple different things you can use.
How to.
How
there.
to.
The queen. The queen has spoken. Okay, Abby, you're up.
Okay, so for my interesting case, I don't have full knowledge on it, but I'd like to kind of explain it. So we have a greyhound, an adult female greyhound. Her name is Java. She was adopted. She was a she was in greyhound racing. So she was retired. She was adopted by her family. We saw her for her annual. She tested positive for hookworms. We treated her with Safeguard, Panicure, Drontal, anything to try to get rid of things. And it came back again with hookworms, same amount. So Dr. Pulse did a little bit of researching and actually found that greyhounds, especially old racing greyhounds, can become resistant to treatments for hookworms, intestinal parasites, things like that. And I have a few things here why. Just because they're in the sand, mostly in Florida where it's warm and moist. So larvae and from fecals and things can spread very quickly. They're confined, things like that. So right now we're in the gist of actually testing hookworm egg count in her fecal, doing treatment and then retesting again to see kind of what works. And actually talking about that, McDivitt, our other doctor, she had a case like that previously at a different clinic. She was actually able to cure them. She found what worked. So it's really interesting now because greyhound racing, it's illegal in 40 states. So technically should be all of them because it's not great. But those dogs are being rehomed with these strains that can't be treated. Other dogs, other family members are picking it up because it is zoonotic. So you have other dogs, a random German Shepherd that's resistant now because a greyhound came home. So it's interesting to go through that and learn about it. So kind of in the middle of it, finding out our answers, but I thought it was pretty interesting.
Mm-hmm.
That's a really cool case.
Yeah.
Yeah.
Drug resistance in general is something that I think we're starting to experience more and more. And parasitic resistance or drugs that we use for parasites is definitely something that is happening. We see it with heartworm disease. So we have resistant strains of heartworm disease, mostly along the Mississippi Valley basin area, but it's definitely a thing. So they're just good at surviving and existing. And I think compliance, meaning like either the dog's not taking the medications, like our heartworm preventions do have dewormers in them, but I think the numbers show like 8 out of 12 months. Owners typically will give heartworm prevention 8 out of 12 months. Well, then we have some, resistance occurring there. Plus then their chronic exposure to the dewormers that are in the heartworm prevention also could be potentially a factor as well.
Yeah.
Yeah. And it was odd for us because she had been on prevention, but then probably just got treated so much on the track for dewormer that it just
Yeah, they were probably deworming all the time on the track. I would think.
Sure.
Yeah.
Just for performance.
Yeah.
Like, so hookworms suck blood, right? So that's one of the things that they're the voracious blood suckers.
Yeah.
That's what they taught us in school. I need to remember.
No, the one thing I remember
Call
about
them
hookworms
voracious
is that
bloodsuckers.
humans get them from stepping in like the sand.
Yeah.
They go through your feet.
Don't go to Florida without
Don't
any
walk
shoes on.
barefoot.
That's right.
I remember from school too, like just greyhounds have that predisposition.
I didn't know that.
I didn't know that either. So it was really interesting to kind of
That is very
dive into
interesting.
it. So
Very good
hopefully give
case.
you some answers on that.
Also important to follow up with recheck fecals so that you know if it's working and then environmental cleanup as well to like no matter what parasite it is so that you don't contaminate or they don't recontaminate themselves. That's always really
Yeah,
important.
because once that's in the soil, you're sort of digging up the first 6 inches or something and torching the yard.
Ooh, wow.
You're
bleaching it and whatever else.
not going to work. So yeah, very cool one.
Cool.
You have to report back.
I will give you an
On the
update. We
results.
should be getting a fecal tested next week for the McMaster's fecal.
Okay.
Yeah.
Cool.
Okay. On to listener question.
You want to do it or do you want me to?
Maybe we should split the paragraph.
Yeah, let's do the.
Let's all go around and do a paragraph,
Okay,
just
you
like
start
in
at your
class.
side, and then we'll go
that
around.
scares
Okay,
me. I have to
okay.
read ahead and make sure.
Okay. All right.
Hello, All Star Veterinary Clinic. I have been listening to your podcast for a while now. Absolutely love it, by the way. We are a fairly new cattery. We had our first litter of kittens at the beginning of December last year. They are now just a little bit over 11 weeks. They got their first vaccine, their FVRCP. Well, I just shortened it. Sorry. FVRV, FCV, FPV, vaccine, modified lab, and MLC. Okay, anyways, on January 19th. After that, only one of our kittens got sick. He had terrible diarrhea, weight loss, and lack of energy. His personality greatly changed. This once playful, feisty kitten now just moped around looking miserable.
My turn?
Mm-hmm.
After him having diarrhea for a few days, we contacted our vet. Our vet provided no help. A couple days later, we took him to the emergency vet. They did in-clinic testing and sent out a PCR. In the meantime, we treated him with metronidazole, Panicure, and Albon. One night, he developed a stuffy nose and kept on sneezing. His nose eventually cleared up, but he still had diarrhea. His PCR came back and showed nothing but Clostridium type A. We continued to treat him with the medicines. We gave him lots of antidiarrheal medications. We gave him 1 dose of Clavamox, but his diarrhea got worse, so we stopped.
It goes on to say, we contacted multiple vets and nobody seemed to have an answer. After about a week and a half, he started to improve. His sweet personality came back and his diarrhea stopped. On February 9th, all of his siblings went to get their boosters. We didn't want to risk him getting sick again, so we waited to get his booster. That day, the whole litter, besides the kitten that didn't get the booster, his name is Lurch, got sick. They all had diarrhea. Some of them even threw up a little bit. After a couple of days, their diarrhea continued. They all started to lose weight. Again, nobody had any answers. Lurch, the previously sick kitten, had been having solid stools for 5 days. About 2 days after his siblings got their boosters, his diarrhea came back.
We contacted the vaccine company and they asked us for the lot number of the vaccine. We checked the sticker on the kitten's pamphlets looking for the lot number from the vet and found that the vaccines our vet gave them were expired by over a month. Our vet and multiple other vets told us that an expired vaccine wouldn't have an effect like that on the kittens.
We've been treating all of the kittens with Panicure and are starting to give them metronidazole. We have also been giving them some homeopathic pills so that if the vaccine was bad, it will be flushed out of their systems. Their diarrhea has started to improve and they have all started to gain more weight. One of them was acting miserable like Lurch and had been previously, but now he seems better. All of their energy is back and they seem pretty normal again. Despite all of that, Lurch still has diarrhea. I guess our question for you guys is, could it have been the expired vaccine that did this? And if not, what else could be causing all of this? We would love it if you guys could feature our question in one of your podcasts, but totally okay if you don't. At Bengals Boutique.
Okay, that was a really informative
Yes.
piece of information or pieces of information because I think it does allow us to answer the question better.
Yeah.
Knowing all the pieces of the puzzle.
Yeah.
Mm-hmm.
Yeah, I agree.
So the question is, could the expired vaccine cause it?
Well, we actually reached out to vaccine representative today to inquire more information to answer your question.
Mm-hmm.
And she relayed essentially no.
Yeah.
Yeah.
I think that the vaccine, our instinct would be to think that the vaccine, if it's expired, is maybe not as efficacious. So it's not going to provide immunity when you give it, but it should not have a systemic side effect. So...
And the only time that you worry about more of a side effect is if the sample of the vaccine has actually been frozen. So that is where you get more adverse side effects and risk.
Mm-hmm.
She had mentioned that like coming on to summertime when vaccines are shipped, a lot of companies will over ice them actually because of the warm weather. So that was another factor as well.
Yeah. So if the vaccine was frozen and then thawed, even for a very minor amount of time, that could potentially trigger some type of reaction. The other thing that would point against the vaccines would be that all the kittens were affected, which would be very strange. So that wouldn't be something, although you might think, because they all got the same thing, but that would be very unusual for all of them to have the same reaction to the vaccine.
Yeah.
So that's also the thing that gives us pause to say, that's kind of interesting. I wouldn't typically see that, with the thing. Unfortunately, they're probably carrying some other underlying issue.
Yep.
That is waxing and waning on them.
Yeah. Well, and I was just going to say the duration. Like if we experience any sort of vaccine adverse reaction, typically it will be short-lived. And this does not seem like this was short-lived.
Also what I was wondering, like how soon after they got the vaccine did they start acting sick?
Yeah.
I don't know if it said that, but
yeah.
Well, in the fact that Lurch didn't get the second round and then
still got sick too.
Exactly.
There's got to be some type of issue, with the underlying immune system, or something that they carried through from their mother.
Yep.
We're assuming they're FAL-FIV negative. That's not in here in the history, but we're assuming that.
Right. That could be
Yeah.
another
That could be
factor.
something if they
But
haven't been
Pan-Luke
tested.
is the thing we were talking about because of the symptoms.
Yep. I mean, just even like if it's going around, we were just talking about parasites, contamination of the environment. They're all still recontaminating each other. They can get them from their mom, especially depending on the environment in which they're set up as too. So are they indoor, outdoor? Are they just so many different factors. Sanitation wise, what are they using?
Well, and I would expect, since these are Bengals, I'm assuming based on the hashtag, then they're indoor, right? So they're probably, breeding Cattery. But the coccidia, which they treated with Albon, the metronidazole could have upset the natural flora.
Yeah.
So it could have been that although you might have gotten an initial result, like an improvement, but then everything's out of whack now that you've used the metronidazole. And so it may be that we don't have normal gut flora too.
Yep.
That's keeping things in check.
Yeah, we really try not to use metronidazole much anymore because we actually sat down with an internist and he shared that research has been shown that when you do metronidazole, it can take up to 4 months.
A long time.
Months essentially to reestablish the good bacteria, because when you're using it, you're getting rid of the bad stuff but also the good stuff. So that's why a lot of times we try to avoid using it if we can with Metamucil or change in diet or probiotics. But of course there's those instances, it's different of frequency, severity, blood, mucus, things like that. So it's still a good anti-diarrheal. You just have to be picky
when you use it.
Yeah, especially for, they're so young.
Yeah.
Their
they're
immune
super
systems
young.
are not strong. So
So it's going to take them a hot minute to get back to normalcy.
To get back to normal. So
GI
using dietary therapy. I don't know if that was mentioned in here or not, as far as therapeutic diets to control gastrointestinal distress. But that, the biome potentially, it might not be suitable for a kitten, but you could use it for short term,
right.
To reestablish gut flora and help treat problem or high digestibility, low residue diets, or, and cats are really hard to medicate. So we really try our best to never medicate them. Well, they're hard because you can't, you start something, you can't finish it, or they don't tolerate it, or you make them worse because they're stressed out because so we really tried dietary therapy or supplements that we can add into food. Yeah. Like the Metamucil.
Well, that's another important thing. She said they did Clavamox for his sneezes and stuff. Well, antibiotics can be really hard on the GI system in addition to everything else. Yeah. So I think there's a lot of factors here. And there's just so many slew of infectious things that can get into your Cattery. Yeah.
And I would caution against Clavamox use for upper respiratory infection. It's not going to work. So at least that's what all the research shows. So,
and just age in general, in antibiotic use in general, you got to be real careful.
So that's not something that we're going to pull off the shelf and use in an upper respiratory infection in a cat. So we would say, hey, if somebody,
I do use it sometimes, and I use it on my own cat, and it worked.
Well, the research shows that it's not hitting the right strain,
not as effective or whatever.
So they talk about using Doxy instead. The other thing would be if our homeopathic stuff had lysine.
That's exactly what I was like, what's in that? I want to know more about that too.
That might be helpful too.
Yeah.
To know what's in there.
So hopefully we answered at least the main concern. Maybe the main concern was the vaccine.
Yeah.
Yeah.
But there's still probably a lot of other things to look at. Yeah. Yeah.
Having a Cattery is really hard. And hard work.
What is a Cattery?
A breeding, it would be like a situation where you have multiple cats and they're breeding and then having kittens. I
see.
And then you would maybe save one of those to breed. You know what I mean? And so you're having multiple cats in an enclosed area.
Right.
It's kind of a simplified way of thinking of it, maybe.
That's fair.
Makes sense.
So, and the problem is they're all in an enclosed area, right? And so then things spread so quickly. Ringworm, upper respiratory infection. There's just there's a litany of things.
Yeah.
So it's really hard. It's hard work running a Cattery, and
oh gosh,
I
bet.
So kudos to you guys for taking the time to make sure that they're all taken care of and basically fixing them.
Get better.
Yep. Absolutely.
Okay. Me?
Sure.
Okay, let's do it. Thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember to send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable. Don't forget about chowder. Cold.
Asian boo boo.
It's very beautiful.
Chowder.
Good job, Chowder.